Hi, my name is Monique. Thank you for being here today. I'm going to be discussing public health legislation, namely the HR 5 Equality Act. Public health legislation is a type of public health policy that combines ideas from the legal system, medicine, healthcare, and public health. Public health law often includes specific legal and health interventions. Thus, the application of public health law, particularly through government institutions, is a critical component in maintaining population health levels. Public health legislation is meant to provide guidelines to help public health at a macro and micro level. Unfortunately, a fragmented healthcare system, along with various socio and geopolitical interests, have collided with marginalized groups of people, such as the LGBTQ plus community. Today, I'll be discussing addressing the marginalization of such marginalized groups, such as the LGBTQ community, and the most recent legislation targeted at improving healthcare access for the LGBTQ plus community. The LGBTQ plus community has made leaps and bounds over the last 100 years, from being banned and seen as a national security risk to now having multiple population-specific legislation advocating for them. It's safe to say that it has been an uphill battle for them. In 1924, the Society for Human Rights was the first gay rights organization developed by Henry Gerber. Although there were other pioneers in the LGBTQ plus community that paved ways for the advancement of healthcare equality, it was this particular establishment that helped increase the visibility and recognition of the LGBTQ community. The formation of this also was able to shed this community in a more positive light, unlike much of the heavy public discrimination that was occurring at the time. The HR 5 Equality Act is one of the most current bills proposed in the United States Congress and passed by the House to address the issue of the LGBTQ community marginalization and discrimination of healthcare delivery systems. It forbids a person's sexual orientation, gender identity, discrimination in sectors such as public accommodations and facilities, discrimination against education, federal financing, employment, housing, credit, and jury systems. The measure specifically defines and includes sex, sexual orientation, and gender identity as illegal categories of discrimination or segregation. These highlighted elements can be all used to justify prejudice, and they all involve a type of sexual discrimination. Individual incidents of discrimination, according to the Equality Act, can have a variety of causes. Discrimination has long since been an uphill battle, particularly thrust into the spotlight in the last 250 years in the United States. Discrimination and racism without the consideration of sexual orientation has created mountains of obstacles for those affected in their daily lives. Additional identities such as gender, sex, sexual orientation have increased the complexity and effects of such issues of discrimination. There are disparities noted in healthcare that are difficult to target and minimize. Healthcare equality for LGBTQ plus patients has woven itself into the most prominent of disparities. This also includes underrepresented populations, different socioeconomic statuses, educational inequalities, and poverty status. It's unfortunately become commonplace for members of the LGBTQ community to experience discrimination in almost every public space, such as restaurants, healthcare facilities, the education system, government offices, and youth providing facilities. The bias and discrimination toward the community, along with other marginalized groups such as those that are Black, Indigenous, and gender diverse, have been shown to have lower equality of healthcare and lack of positive patient outcomes, which is alarming to say the least. The importance of addressing implicit bias in healthcare goes just together with the implementation of the enactment of the HR5 Equality Act. Implicit bias shapes healthcare providers' behavior and how we behave and perceive our patients. This can result in disparities amongst different races, ethnicities, genders, and sexual orientations. It creates a chasm between the healthcare provider and the patient. It affects our ability to create and establish rapport between the patient and the provider, especially if there hasn't been any type of sensitivity training, or if the healthcare provider has simply been raised under different circumstances and are not culturally sensitive to these different types of marginalized groups. For example, there's patients who have STIs and they won't come in and have treatment done for the concern of discrimination. And this occurs with heterosexual patients. Now, if you include different patient populations, such as the LGBTQ plus patients and other marginalized groups like Black and Indigenous Latino patients, then it adds an additional layer of difficulty in establishing care and desiring to seek care because of the concern of discrimination. We just don't know how we're going to be treated or perceived, so this indeed creates issues with obtaining care. Now, the biggest issue with this is not only do patients not feel comfortable seeking care, however, they are increasing a public health risk in antibiotic resistance if they do not get treatment, as well as resistance and morphing pretty much of the organism that they're infected with, because they could be spreading it to other patients. So my position is working in the healthcare field has really opened my eyes to many healthcare disparities encountered really on a daily basis with patients. The foundation of basis for caring for these patients has been centered around nursing principles and theories. One primary nursing theory that is applicable is Dr. Jean Watson's theory of caring. She believes in caring for the self as a provider, caring for others and the nature of others, and creating a holistic form of care in ensuring that patients receive that equal form of care and non-discriminatory type of care plan forming. Dr. Jean Watson created the Caritas process, which is a process sustaining humanistic, altruistic values by practicing love, kindness, compassion, and equanimity with yourself and with others. This is entirely applicable for all patient populations. Because I feel aligned with my roots in the art of nursing, I wholeheartedly support HR5 Equality Act. Allowing for unfiltered self-expression of identifications of patients without the fear of discrimination or lack of high-quality care has always been a goal of mine to achieve with every patient encounter that I've had in my nursing career. Creating a safe space that facilitates open communication, meaningful listening, and shared governance between the patient and the healthcare provider is really what is an underlying pillar of the HR5 Equality Act. Here's my call to action. To my fellow healthcare providers, I'd like to challenge you all to implement equal healthcare to marginalized groups and majority groups alike. We must remember that as members of a critical aspect in the lives of our patients, we have the ability to make changes no matter how big or how small. Patients that are identified in marginalized populations are in need of advocacy and representation, and who better to provide it than healthcare providers themselves? One deficiency I've noted in the healthcare community is the gap present between the medical model of treatment and the nursing model of care. Adjustments must be made in seeing patients in a holistic manner, rather than treating their diagnosis before acknowledging who the person is, as is commonly seen with the medical model of treatment. This also explains one of my major passions as to why I went into nursing rather than medical school. The nursing model of care takes the whole patient into account, and considering this, we must make a conscious effort in identifying and validating patients who are considered to be in marginalized populations, such as members of the LGBTQ plus community. Supporting legislation such as the HR5 Equality Act will help reshape the current landscape of healthcare, ensuring that patient-centered, evidence-based, holistic care is available and provided for all who seek it. Thank you for being here today, and I hope this makes a difference in how you see public health legislation as it affects LGBTQ plus populations and marginalized communities. Thank you.